Stewie, what's going on? Aren't you supposed to be at daycare?
What the heck?
I escaped.
They're appearing to show a shoulder dislocation. They're very painful because the muscles are spasmed around it, yanking it up into an area that is not into the joint. A lot of times we'll actually have to use medications to help augment the body to relax to be able to put it back in.
What happened to your arm?
I finally stood up for all of us and told Miss Emily we should be given a proper lunch and not just what's left over from her Baja Fresh. And she said I shouldn't raise my voice and pulled me really hard into the other room and my arm came out of its socket.
Oh, no. Actually, super common for a specific age group where you can actually have something called a nursemaid's elbow. The radius comes out of the annular ligament of your elbow, putting it back in, super easy, and you look like a hero to the parents.
I'll just pop it back in.
You most certainly will not. I need to go to a hospital.
Brian, is Stewie in there with you?
Mom!
We're in here, Lois. He's napping. Relax. I'm going to pop it back in.
Not how you do that. There's multiple different techniques that are very gentle, not forceful, not aggressive. And once it's back in, feels much better. The only issue is you're a little bit more at risk for having another shoulder dislocation because now the ligaments are a little bit more lax in that area.
Get in there. Come on. Hold still, Stewie.
Oh my gosh. Old school wise, you bite a piece of leather, a stick, endure the pain until it's over and then it's fixed. Now we can use pain medication or sometimes we can actually just do conscious sedation to knock somebody out for 5 minutes and put it right back in.
Hey, Peter, you want to earn another $10?
Of course I do.
Great, I got a hilarious one. I'll give you $10 for your L4 vertebrae.
Oh man! He wants his L4 vertebrae, which is really low in your lower back. We have people that come in that have compressed force where it's squished down. They can actually inject a type of polymer in there to pop it back open. But actually having donor vertebrae, you can't just put a new one in there. It doesn't work that way. They're off in the operating room. Good job. Actually, it looks quite accurate. If they're out cold like this and they're prone, they're on their stomach, they're going to have oxygen. They're going to have all these other things where the anesthesiologist is making sure that they're okay.
So,
What?
I guess this means, Peter, you're our Joe now, and Joe, you're our Peter.
I know I've gotten a million comments from you guys that said that Joe didn't have a spinal cord injury that ended up in a chair. It was related to a lot of trauma and injuries to his legs.
I have a request. Yay, Joe's chin!
Oh my gosh, so now they swap chins. There's many different procedures out there. A plastic surgeon could add different inert type of materials to make a chin larger, change the shape of it. I don't think you need to have a donor chin. Oh, he's sick. Pain relief for menstrual cramps. Pharmaceutical companies label it for menstrual cramps. They even have specific names. Typically, they're either Tylenol or ibuprofen.
Hey, Stewie.
Oh, hey, Bri. Guess who woke up to a red dawn?
I'm assuming the red dawn is just referring to blood.
I'm having my period. It's like the shining elevator down there. My 21st century box has been conquered by Eric the Very Red.
Yeah, this is getting dangerously close to a Will and Grace now. But if you're bleeding down there, it's clearly because you hurt yourself.
I like that Brian is bringing up the fact that if he's having bleeding down there, there's something else going on.
Oh, yeah? If I'm not having my period, then why am I drinking herbal tea from a large earthenware mug with no handle on it?
To have menstruation, you have to have a uterus. You can't have active bleeding and menstruation with testicles and a penis at the hospital.
All right, Mr. Quagmire, I understand you have the hiccups.
Oh my gosh, we deal with this all the time. People come to the emergency department with hiccups that just won't go away. Main medication that we use is something called Thorazine and have had very good success.
Now, it says here on your chart you've tried boo. Outside of that, the best way to treat hiccups is through hypnosis.
I guess there's an option for hypnosis. There are a lot of different techniques that you wouldn't think to do for different medical problems. When somebody has something called supraventricular tachycardia, sometimes if you just splash somebody's face with a bucket of ice, it actually can fix it. It just has to do with shocking the system.
My mama always said that hiccups are a sign that the devil's got a hold of you.
Oh my gosh, no, it is not a sign that the devil has a hold of you. A hiccup is an involuntary contraction of your diaphragm. It's spasming for some reason. There's multiple different reasons why it would spasm, but ultimately it is your diaphragm, the muscle, that's causing the issue.
Satan, release your grasp from this man. In the name of Christ, I exorcise thee, infernal invader.
There's a million different wives' tales out there, home remedies. I have a fantastic remedy that is not doctor related. Put each finger in your ear, tilt your head back and have somebody pour you a glass of water and just continue to drink the water until you can't really drink it anymore. It always goes away.
Lois, have you seen the pooping iPad? I can only go while watching Tiger King.
Oh my gosh, the pooping iPad. Okay, we should not be bringing devices into the bathroom. Are we touching our bottoms by accident with a tissue paper that is now covered in poop and now we touch our phones? Just something to think about. But how many of you guys are actually watching this in the bathroom right now on your device?
Huh?
The iPad we use only while pooping and occasionally on flights for Stewie. Ew.
Why are Stewie's eyes so jacked up? When you see eyeballs where the whites are red like that, we call that injected. His eyes are protruding out of his head almost as if somebody who would have hyperthyroidism. And then he's got a lot of redness around the eye, which you'd be concerned about, almost like a cellulitis.
I play Elmo's ABCs on that. Is that why I keep getting pink eye?
He's getting pink eye from poop. Poop typically harbors E. coli, and then you're getting E. coli in your eye. That's disgusting. Typically there's drops, there's ointments, there's different things that you can use, and then you definitely need to see an ophthalmologist.
I don't know where it is, but it's definitely not in the shed, so don't even look back there in the shed.
What, you mean the earwig fortress? No thanks.
The earwig fortress. Earwigs are these tiny little bugs. They crawl in people's ears in the middle of the night and you hear it really loudly touching your tympanic membrane, aka your eardrum. I've actually had to pull many of them out of people's ear canals.
Yeah, too fast and too smart for you, earwigs.
Oh, there it is. Oh my gosh, oh my gosh, oh my gosh. No. You can see if you look, it's got these like hooks. So what happens is it actually hooks on in there. Definitely cause a lot of pain, discomfort, and cause people like freak out. So if this does happen to you, get to the hospital. We can get it out super fast because we have the tools to be able to do that.
Now to continue clearing the yard, collecting moisture and sleeping in wood.
No, there's not a direct connection from your external auditory canal, which is the ear canal, into your brain. Unless it like eats through the tympanic membrane, which would be very painful, and then goes through the oval window.
We've got to get to the hospital and get Stewie vaccinated.
Yeah, it might be a little too late for that. I kind of destroyed all the vaccines in town.
Yes, I love the Joker outfit. That is awesome. I actually was the Joker for Halloween last year.
Why so serious?
People don't realize you have the normal schedule for childhood vaccines, but if there's some hesitation or you don't want to give them all at once, there's actually a delayed type of vaccine schedule as well. Instead of getting, say, 3 or 4 shots all at once, you can actually spread it out.
You destroyed all the vaccines?
Yeah, but it's fine. There's nothing to worry about. Is anyone else feeling feverish, achy, and acutely sensitive to light?
Oh my God, Peter, you've got measles.
Oh my gosh. Measles is controlled most of the time, but if the herd immunity dips down even a little bit, you can actually have outbreaks in a community. If you can take vaccines, please make sure you take it for measles.
We gotta keep you away from Stewie. You'll get him sick.
Oh, my little guy's gonna be fine. All he needs is a good old-fashioned game of hot breath telephone. Measles.
Oh my
get out of this
gosh.
house.
The concern is, yes, the very young, the very old, and the immune compromised when it comes to measles. Measles can cause meningitis, encephalitis. You're trying to avoid exposing this population to somebody who has the measles and this virus. Oh, bottle cap? Oh no! Oh, snap neck, fractured jaw right there. Oh my gosh. How many of you out there skateboard and have gotten stuck on something so small on the ground that it catches the wheel, doesn't allow it to roll, and you just fly? Ouch. Okay. A lot of times when people land on their chin, we actually see laceration that occurs. A big thing you always worry about too is if you hit your lip or your tongue in between your teeth, that you actually bite on it and then it actually does a through and through laceration, which can be a little bit complicated. Oh, it's the running of the bulls. Oh my gosh. That is such a dangerous thing. You really got to be careful when you're doing that. That type of impaled injury could lead to permanent disfiguration. Obviously, in his case, he's not able to use his legs from previous injuries, but you always worry about infection. You know, you got to clean that wound out.
Joe! Oh my God!
Oh my gosh.
You all right?
I can't feel anything below my neck. Can't move a muscle, guys.
That's not good, but he's able to breathe, which is actually very good because your diaphragm is innervated by nerves 3, 4, and 5. And there's actually a funny mnemonic that we say 3, 4, and 5 keep your diaphragm alive. Oh, wow. That's a halo for cervical fracture. Literally, the 4 points that are circulating around his head are screwed into the skull. That way you literally cannot move. It needs to heal, and you're put in this apparatus.
Mr. Swanson, I did an exploratory procedure which revealed extensive damage.
Please just tell me, am I completely paralyzed?
I'm afraid of ghosts.
He's afraid of ghosts.
I ain't afraid of no ghosts.
Sometimes in the initial phase of somebody getting bad cervical injuries and spinal injuries, there's a lot of inflammation and swelling. It actually behaves like you were fully paralyzed, but sometimes when the swelling goes down, there is actually a chance you regain the function of the area that has been paralyzed for a short period of time.
And yes, Mr. Swanson has lost all movement and will require around-the-clock care.
Around-the-clock care, mostly discussing, meaning like peeing, pooping, cleaning, all that stuff. So we do it to babies all the time, and we do it to the elderly population as they get older, so it's just a part of life. It's a fact that we all have to deal with.
If there's anything I can do.
There actually is. Could you collect my mail forever? I'm leaving Joe and moving to Europe. I didn't sign up for this.
Wow, that's messed up.
That's messed up.
When somebody you love gets injured and then you just ditch them. Not cool, don't do that. Definitely have conversations with social work, a psychiatrist, psychologist, and work with the individual. Nice. Oh, wow. With boxing injuries, we typically see somebody might have a broken nose, potentially cauliflower ears, hematomas to the ears themselves. You gotta be really careful of repetitive hits to the head, which can cause increased risk of bruising and then increased neurologic problems in the future. Just be careful out there and protect your noggin.
Ow.
Well, it's broken all right.
That's so messed up. That hurts, but actually when you do that, you can actually feel crunching of the bones. The biggest thing you want to make sure is that it's straight. Typically, it heals pretty well when you put it right back where it needs to be.
If you don't want to fight anymore, you don't have to.
Well, good.
Oh, I love you, Lois.
I love you too, Peter.
Is it cool if I tell your insurance that I gave you heart surgery?
Oh my gosh, Dr. Hartman. We just do our job in the emergency department. We order the tests that we need to test, the studies that we need to do. We don't know specifically if somebody has insurance or not insurance at that specific time.
Broken arm, huh?
Oh, look at that broken arm. You can see a major deformity. Ouch, you gotta fix that. You could potentially cause some ischemia to the tissue if it's tenting the tissue like that.
Hey, get out of here!
I haven't witnessed or been in a hospital where somebody is actually dressed up as a doctor or a nurse when they actually shouldn't be there. But I also work in the emergency department where we have a lot of security. It's a very busy place, so you want to make sure that only appropriate people are there and supposed to be there.
That arm looks broken. We'll have to get you some painkillers.
Typically in the emergency department, we're gonna sedate you and put it back in alignment. And we'll get an x-ray after just to make sure. We'll use medication so you don't remember it and you'll fall asleep.
Oh, poor Brian. Have your pain meds kicked in yet?
Oh, yeah.
You can get very broad range of medications to help with your pain. You can go simply as like Tylenol, ibuprofen, all the way to really strong opiates. But just depends on your pain, and typically they're temporary.
How does it feel?
Oh, yeah.
Where are you going?
Oh, yeah.
Huh, I want a whole yeah. Or maybe just a half of a half.
Okay, so this brings up a good point. It is illegal to be taking other people's medications that are prescribed to them. You're not 100% sure if there's actually an interaction that could be dangerous to you. So I would advise against it.
Hey, man, we should get out of here. The building's on fire.
Hey, pal, not now. I'm busy. Anyway, I'll tell you what's on fire. My urethra.
What's a urethra?
It could be a urinary tract infection, or we think about an STI, a sexually transmitted infection. Sometimes it could be a kidney stone, but you're really worried about a sexually transmitted infection.
That's the last time I go to a water park, I'll tell you that much.
Interesting, he's blaming it on a water park. So typically there isn't like a retrograde where water would go up the urethra. It typically doesn't happen, maybe a little bit near the tip, but it should be cleared out when you actually urinate.
So, Doc, I figured if Charmise and I are going to live as man and wife, I ought to get her checked out.
Of course.
What? This is a very inappropriate, weird situation. You actually wouldn't put the patient in stirrups like this, and most likely they're facing the door. So if somebody accidentally walked in, they're just, everybody sees everything. You wouldn't do that. It'd actually be turned around. They're in what's called the stirrups. The stirrups basically change the angle of the pelvis. The reason why you actually have the angle of the pelvis change is because of the uterus, the organ that you're looking at. You're looking for the cervix. You're trying to feel the uterus as well as the ovaries on each side.
Charmise, when's the last time you had a pelvic exam?
When was the Missouri Compromise?
Yep, there are definitely scheduled times of when somebody should be getting pelvic exams. The frequency just depends on your activity and age. But in the emergency department, we do them emergently. Typically, if somebody's having a significant amount of vaginal bleeding, if there's vaginal discharge during pregnancies, or if there's any pain or injuries down in that area as well, we'll do pelvic exams.
I think 1821.
Then I've never had a pelvic exam.
What?
All right, I'm going in. If I tug on the rope twice, that means pull me out.
The rope is inappropriate, but it's putting on a hat that has a light on it. It's quite helpful in certain situations.
God, who are the pigs who just throw their empty beer cans down here?
If you're having any procedure where you're going to get that significantly close, you should be gowned up, wearing gloves, depending on the sterility of the situation that you need. Does it need to be clean versus sterile? Oh, wow. He walked and snapped his bone, and it's tenting through the skin. It didn't pop all the way through, so it wouldn't be called an open fracture. It's still a closed fracture.
Holy crap, Brian, you okay?
How's it look, Doc? I'm sorry to say you have hip dysplasia.
What's that?
Oh, hip dysplasia. So it happens with dogs, typically not seen in human beings. Brian's leg is potentially shortened and externally rotated. Depending on where it's broken, the orthopedic surgeon will use different types of hardware or metal to reattach basically your leg to your pelvis.
I'm not sure what dysplasia is, but I do know you don't often see a Y that far up in a word.
There are some times when a doctor may not know the exact origin of a medical term, but hip dysplasia is basically a term that we use relating to the abnormal growth and some gentle abnormalities relating to the hip, which then could lead to fractures, dislocations.
I took the liberty of x-raying my own hip to show you what a normal one looks like. Why does it look like there's a Batmobile in your colon?
That's good. I've seen plenty of unique objects that have been lodged up in the rectum. Typically, it's just your standard light bulbs, scotch glasses, but nope, actually not one of these cars.
Wouldn't hurt to lose some weight. And he won't be able to walk until his hip heals. He'll need someone to take care of him.
I'll take care of him. Like you took care of me when I was sick.
The reason why we say weight, because you have more weight on the joint itself, and it's just putting more stress and strain on that joint. You know, the bodies are not made to have excess weight on it, and that's why you get concerned with somebody's weight, not just from diabetes, metabolic syndromes, cardiovascular disease, high blood pressure, but even just your joints, arthritis. You know, the more weight, the more it's going to hurt when you actually have inflammation of the joint itself.
Come back in a week. We can check your... What is that? That's the sound a blood pressure machine makes. I do impressions for the Doctor Talent Show. Do you know what this is?
Rap.
An MRI? Yes! Adding that to my set.
I mean, I've actually had an MRI done on my ankle when I was playing soccer back in the day, football for every international person out there. But it doesn't go rap. It goes like clank, 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 clank. Changes up the frequency. Literally, you're in there just like listening to the banging noise as you're trying to listen to music and relax.
So, Doctor, is Peter healthy?
My goodness, you'll be dead within a month.
Dr. Hartman is using his stethoscope to listen to just the abdominal noises and sounds. What you're listening for is basically to hear if there's any movement or not movement. You know, listening to somebody's abdomen and then saying they have a month to live. Yeah, I wouldn't listen to that, doctor.
Mr. Griffin, you're going to expire in a month. This is your driver's license, isn't it?
Oh my gosh. You can have labs that show that you have renal failure, that if it's not fixed, you can die soon because of abnormalities of electrolytes that might then cause you to have cardiac arrest. Unlikely that a blood test is going to tell you that your existence is not going to continue after a month.
Now, Mr. Griffin, that liver's got to come out.
What?
It's been in the microwave for 3 minutes. It'll get dry. Now.
Please.
Just focus, Dr.
Please.
Hartman.
We can't take any more shtick. Please just tell us, is Peter healthy?
Oh, yeah, he's fine. He's just really fat.
Oh, thank God.
Wait. Hang on a second.
Yep.
Did you just say I was fat?
Well, yeah, you are pretty fat.
Okay, this is news to me.
Excess body weight can lead to metabolic syndrome, which then can lead to diabetes, hypertension, cardiovascular disease, a whole plethora of problems. Nice.
I notice your kid is having some trouble.
I get a question all the time, you know, what is the right age to start working out? Is it going to stunt my growth? Is it going to cause injuries? You should work on technique using body weight first, and then getting the techniques down, and then you can slowly start adding weight as you get better at the movements, because you don't want to, you know, get into bad habits, put excess stress on your joints because of the growth plates itself, and, you know, causing potential injuries to those areas.
You're telling me.
Oh, your kid just needs a little help. I got something that'll get him going.
Oh my gosh. At least they labeled this weird open syringe as steroids. And we actually use different types of steroids at the hospital, but we do not use what's called anabolic steroids, which are the steroids that make you, you know, big muscles. You got to be really careful with those because they have a lot of side effects. They're replacing your own natural steroids that you're making in your body. And it doesn't strengthen your tendons. It just strengthens your muscles. Your growth of your muscles may increase faster than the strength of your tendon and your connective tissue. So you have to be really careful, and that is why people sometimes have an increased risk of tendon ruptures when they're actually using steroids.
Here, Stewie, try this.
Yeah, what the hell are you doing? Whoa, suddenly I'm full of energy.
A lot of people assume medications that we give will work immediately. You know, sometimes we'll give somebody a sedative. It typically still takes like 30 seconds for it to work. And it also depends on the route. IV is obviously faster. IM is a little bit slower.
Hello, family.
Look how jacked he is. It's huge. If I saw a kid that came into the emergency department that was like ripped and jacked, I'd be super concerned and maybe get social work and case management involved just to have conversations with the family on a different level.
Hey, any of you know how to tie a tie? I have to go to a patient's funeral.
Luckily, as an ER doctor, we don't use ties. Somebody could use it against us. And that's also why even police officers, when they have a tie on, it's actually a clip-on. That way it breaks off right away.
Peter needs to lose weight, and we were hoping you could help us.
Sure, there are a few options we could try. You can increase your exercise.
Pass.
Switch to a vegan diet.
I'd rather die.
Or quit drinking.
Exercise is really good for you.
It's good for you!
Good for your heart, good for your muscles, good for long-term health. But typically you can't exercise out of a bad diet. With the majority of us, if you want to lose weight, you have to reduce the amount of calories that you're getting in your body. And then obviously alcohol, there's actually no true health benefit to alcohol. That's why if you do stop drinking, you actually lose weight pretty quickly.
What did Honey Boo Boo's mom do? We have a similar workout.
I'm a beauty queen.
She had lap band surgery. If you're interested in that option, the hospital is running a promotion where it comes with a free Nintendo Switch.
Oh my gosh. They put a band around your stomach to make your stomach smaller so that way you can't ingest as much food. Most doctors require that you actually show that you're starting to reduce your own weight by the normal steps of, you know, reducing calories, exercise, watching what you eat. You don't want to have the surgery and then not have any lifestyle changes. Whoa, hey. You don't lose weight that fast, and you don't want to lose weight that fast because then you have a lot of excess skin.
Okay, so if I got like more skin,
it hasn't had the time to tighten back up, and then you're gonna potentially have to have surgery again to have a skin reduction.
I feel amazing, like a bride on his wedding day.
The skin is still innervated, meaning it still has sensation. So you're gonna be dragging that around on the ground. You're actually gonna feel it. It's gonna feel weird, awkward, and maybe even painful.
I can taste the floor.
Decided to try that radical penis enlargement.
Peter, I don't think...
Ryan, your objections are duly noted. Now hit the gas.
Whoa, don't do that. Oh! Do not do that. You are gonna cause massive amounts of bleeding. Literally, we'll have patients who have Foley catheters, and they'll try to rip those out, and the amount of blood that comes out, and the trauma and the damage, you can have major urethral injuries. No, you don't want to do this.
You know that would never work again in a million years.
Don't need it to, Brian.
There is surgery out there. They do penile transplants for people who've had trauma to their penises or severe cases of micropenis, but please do not attempt any of this that you see. What? I don't know where this scene is going, but at least there was some blood. So I'm assuming they wanted to be in a blood vessel giving this injection versus when we do an intramuscular injection, we don't want to see blood when we draw back.
Okay, Mr. Griffin, now you've got your flu shot.
Will you stop giving him flu shots?
People will have an immune response to a vaccine because they're reacting to something foreign in their body. Sometimes people feel fatigued, body aches, weakness versus having euphoria like Peter.
It's cool. It's cool. This is the doctor that killed Michael Jackson.
So Michael Jackson was getting injections with propofol, the medication that we use in the emergency department for sedation. A lot of the big side effects that we see with propofol is actually hypotension. So you can actually decrease blood pressure significantly. Oh geez. What's the matter, Chris?
Peter, I'm really worried about Chris. The shock of seeing Arthur Valentine die seems to have really gotten to him. I've never seen him so depressed and catatonic.
Catatonia, basically when somebody's awake, breathing, but non-responsive in the sense of not talking, not being aware. There's multiple different reasons why this occurs, and a lot of times it's somebody who's seen something traumatic.
In Awakenings, Robin Williams tossed a baseball to Robert De Niro, and he snapped out of it and caught it. Maybe we do that? Chris? You doing okay?
Geez. He's gonna hit him, I know.
We thought we'd... Awakenings!
Peter, I'm not sure that's...
Oh my gosh. You're gonna cause a jaw fracture, hematoma, fracture of the inferior socket of your eye or your maxillary sinus here, all the bones.
What if I try it with a basketball?
No. Oh my gosh.
Oh, God, that broke his nose.
I feel like the baseball would actually do more damage than basketball. Two major areas of the nose. One that's in the back and is dealt with major blood vessels back there. And then in the front, it's on your nasal septum and it's called Kesselbeck's plexus.
He didn't even flinch. It's bad. Let's do your thing. Let's twirl some toilet paper up into his nose and then we'll do your thing.
Sticking some toilet paper or tissue up the nose, people do all the time, but you need more compression. That's just gonna soak it up. Compress the area, hold it there. Pressure is your best bet.
It's about my dad. He wants to have a sex change operation.
Typically, if somebody's having this type of surgery, probably do hormone therapies. Some rules require that you live for a year as the gender that you identify as. You just don't want to get into a situation where you're having major surgeries, you're removing organs, and then all of a sudden you want them reversed, and you get into a situation where you actually can't reverse those processes.
He has an appointment Friday with Dr. Hartman to have the procedure, and he wants me to go with him.
I thought he was like a family doctor. Typically, surgeon's a surgeon, and there's subspecialties within surgery. Then you have like family medicine doctors, internal medicine doctors that do general medicine practice. Then you have myself, emergency medicine doctor, who does emergencies.
Here's the deal. Anything he lops off, we get to bring home for Brian.
What? I've not been privy to any of these type of surgeries. It is definitely not like a restaurant where you get the leftovers and the bones to go, and so you can give it to the animals at home.
Wow.
You wouldn't literally go out to see family with blood all over you, wash yourself, change your clothes. Like, no, they don't want to see that.
That thing was on there.
That thing was on there. Yeah, it's part of the anatomy of a human being. And penectomy is actually the word for penile removal. The biggest things you worry about are the blood vessels and the nerves.
How is he, Doc? Is he all right?
No, I'm afraid not. But she's gonna be just fine.
There you go. I mean, that was the fastest surgical recovery ever. Typically, no, you'll end up going to the PACU. The after surgery care unit will have the anesthesia wear off, make sure there's no excess bleeding.
What do you think, boys?
I'm walking on sunshine. Whoa!
It's great that Quagmire is supporting somebody who's having this choice. You want family support. I think that was a good depiction, even just in this scenario, even though Peter's kind of making a little bit of a joke about it.
Look, I don't really feel comfortable sharing my health problems with one of my buddies. Can I get a different nurse?
You're in a hospital, Glenn. Anything you say is private and confidential and legally protected by
Don't say it.
hippopotamus.
Hippopotamus. No, HIPAA. It's a law that we have that basically protects the sensitive information of a patient. Okay, and there's other components to it, but that's like the general part of it. So doctors won't wear white shoes typically because they're going to get messy with blood, guts, poop, snot. Typically you want to wear something that's actually just whatever color. Maybe it's a uniform that the hospital's making you wear, but something that you can actually wipe off and clean.
You know.
Sure.
And I don't have a prayer of finishing unless I kick it up a few notches, like weird notches.
Oh my gosh. At the hospital now, we used to use pagers. Hospitals, these little cell phones that were at the hospital, but everybody would lose them. Now they actually have it so you can use your own cell phone as a physician, and all the calls get forwarded right to your cell phone. But patients think maybe that you're on your own personal phone, but it's like, no, I'm getting hospital numbers. So I'm like, hold on, I gotta answer this.
Mrs. Fletcher ends and Watchmen starts, which scares me, but now it's too late because everything's,
Oh, my stars.
Hold on a second, I got a text.
I don't know exactly what's happening. So for me at the hospital, does this happen where maybe I have to pay attention? Typically not. As an ER doctor, we're trained to kind of just be aware of everything going on around us. Sometimes patients will just tell a story, long-winded stories. Unfortunately, we are trained, and I'm a New Yorker, to be able to interrupt at the appropriate times to kind of redirect the questioning to get specific answers that we need relating to your health versus like, hey, 10 years ago, this happened, this happened, this happened.
Hey, how foon would it be if we waved sticks around?
I really don't know what we're doing.
It's foon from the word before. I don't see what.
Oh my gosh!
First, let's take your blood pressure, because that's like our favorite thing to do around here.
Oh man! If somebody came to the emergency department with a foreign body stick in somebody's eye, you want to stabilize that bad boy. That way it's not just like willy-nilly flopping around. You're gonna eventually get the vital signs because you need to know heart rate, blood pressure. You need to know what you're dealing with, respiratory rate, temperature, that sort of thing. Obviously there's going to be a globe rupture, a rupture of the eye itself because there's a puncture wound to it, and it is dirty, it is foreign, so there's definitely going to need some antibiotics. Now the question ends up being, where was it injured, and then is the retina injured? You need an ophthalmologist. Oh man,
Okay,
what the? Oh my gosh, like blood brothers. Yeah, no, please don't do this. We do not need people mixing blood. That's how diseases are spread. Bloodborne pathogens, right? The big things, HIV, hepatitis B and C, those are your big ones that you worry about. There's definitely other bacteria out there you can share. Please don't do this. And obviously now you have a cut on your hand. You're gonna leave it open, or do you need to come and see me in the hospital and get it sutured closed?
I think we should hold hands more often.
There you go. We're blood brothers now. You happy?
Actually, yes. I mean, I really feel the bond, Brian.
Just having a little kid, right, having access to knives, probably not the smartest thing in the world. If a kid at that age comes to the emergency department who had access to a knife, Child Protective Services are definitely going to be called, and you're going to get questioned a lot as a parent. Aww. Whoa.
What the hell? Ow!
Ew, what's this?
Has he got herpes?
You son of a... You gave me herpes!
Typically, you give somebody the herpes 1 virus when you have your own outbreak on your face and then pass it along to somebody else via like kissing, touching the face, where there's another open sore area. Same thing when you get herpes simplex 2, which is basically genital herpes down below. Again, same idea. But just remember, you can always give the virus down there, and you can vice versa give it back up the other place.
What? What are you talking about? When we swapped blood, look at my lip. It's a disgusting herpes sore. And now I have some very uncomfortable phone calls to make.
Anybody that you might have kissed or been partners with, you should definitely let them know that you had an outbreak so they can get themselves checked out. That goes for any STI.
Look, it can't be my fault, Stewie. I don't even have herpes. Oh, yeah? Let me see. Hey, what are you doing? Stop it. Oh my God, look at you. You're more herpes than dog.
You're more herpes than you are dog. People try to hide it. Male genitalia, obviously difficult to hide, but female genitalia, sometimes it can be obviously in an area where you can't see because it's inside.
You knew you had herpes. And
he knew he had herpes and he shared it.
Relax, it's not that big a deal.
So I will say that a large population of society has the herpes virus within their bodies. Not everybody has an outbreak of that. So typically, herpes virus is not spread via the blood. I guess there is a theoretical risk that could occur with blood transfusions like this, but most of the time it is basically like contact of the herpes virus to an open area.
Are you even listening to me? You've got to stop coming home so late if you can't get up in the morning. And
that actually could happen, one, from being super tired, but another is just being woken up in different stages of your sleep. So if you're woken out of like your REM sleep or very deep sleep, you're going to be like groggy and be like, I don't hear anything. But you also could hear it if you've ever heard of something called tinnitus, which is high-pitched ringing of your ears due to typically damage to the ear itself. Kind of scary to wake up and you like not hear somebody's voice. A lot of people worry about having stroke. Typically, if it's just your hearing, it's unlikely related to a stroke. Could it have a specific area of the brain? Possibly, but typically it's probably some other reason why. Obviously, if you're on fire, stop, drop, and roll, right? Smother it out, get checked out for the different degree of burn that you got.
Oh, God, I can't hear Garfield.
Wow, here we go. So there's different types of hearing loss. Typically, there's sensorineural neuro or conductive hearing loss. It has to do with how the sound is transmitted and then perceived. Is it a neurologic problem, a nerve issue, or is it related to like the bones of the ear and the different windows where things have to move and the air moves and sounds?
What's going on? Can he fix it in time for me to DJ at the music festival?
no.
What?
No.
What?
If somebody's actually having difficulty with hearing, we actually would like rub our fingers near the ear itself and see if somebody can actually hear that. And then you can actually use something called tuning forks that will help to determine the differentiation. Is it basically conductive versus sensorineural neuro, in the sense of if you smack the tuning fork, do they hear high pitch, low pitch?
Lois, you in the bathroom?
The biggest thing I can think about in this situation is not, two adults, but when sometimes you have a newborn and you put the baby in the bed. From my experience as a physician, it's probably not the smartest thing to do. Maybe consider using a bassinet in the bed or next to your bed.
Well, Mrs. Griffin, you have 3 crushed ribs, but I was able to stop the internal bleeding.
The rib could cause bleeding for multiple reasons. You can have some bleeding from the rib itself. You can have bleeding from the blood vessels that run underneath every rib that we have, or the rib could actually puncture the lung. It could puncture the spleen or the liver. Rib fractures are horrible. They're very painful. You can't really brace them because you can't stop somebody from breathing, because it'll decrease the amount of air that's moving, which increases your risk of getting pneumonia and an infection.
No, we don't. He practically smothers me every night.
Well, are you hogging the blankets?
No.
I mean, I appreciate the hey, try to figure out why he might be smothering her at night. I would think of 2 things. Either don't sleep in the same bed for a short period of time, or have like a barrier up when you go to sleep.
And if he's not smothering me, he's keeping me up all night writing with that giant plume of his.
Dearest Augustine, I do hope this latest damp has not aggravated your gray lung.
Why would a feather pen or a plume keep somebody up at night? I do not know. But him being up at night with a light on, having lights on definitely messes with your ability to go to sleep. That's why they say, don't, sleep with the TV on. Don't use your devices before you go to sleep. It has to do with the input that you're giving into your brain, saying, oh, it's light out. Let me stay more awake and be more focused.
Aggravated your gray lung. Dip, 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 dip.
Dr. Hartman called about my x-rays. He said my spine is now disfigured.
Ah, okay, so typically a spine that becomes disfigured is potentially from muscle spasms, obviously fractures, but a fracture causing the spine to be so disfigured would also have significant other implications, compressing nerves, not having other functions of your body parts.
Well, I'm off to buy imaginary groceries.
Oh! I see people that come in after falling down one stair versus like a whole flight of stairs. People will say, I fell down the stairs, and we'll always ask, wooden stairs, concrete stairs, carpeted stairs, how many stairs? It actually really helps to know the mechanism and what the surrounding environment was like. Obviously, you want to check on them. You don't want to move them too quickly. You actually want to stabilize their C-spine, because if you roll them, their head's going to stay or move in one position or the other, and if they have a cervical fracture, you might do more harm.
I don't know. You idiot, this is your fault!
And obviously he's unconscious at this point, so call 911 and don't yell at each other. It doesn't matter.
What do we do?
Is he breathing?
It looks like it. That's a good sign, right?
Oh, look at that nice laceration to his scalp. Instantly, if somebody has brain trauma and they're starting to vomit, bad sign. Could be due to pain, also could be due to brain swelling. In an instance where you lose consciousness, you're vomiting, and you're altered, you definitely want to CT scan that head.
All right, he's not waking up. I think we got to take these bandages off and see what we're dealing with here.
So at least they put bandages. Oh my gosh. Holy cow. Are you kidding me? We got flies around the bandages. We need to get this kid to the hospital ASAP.
Oh, crap. You smell that? That's brain smell.
I'm assuming this is open skull fracture. Where you see brain matter, you need to get to the hospital ASAP. The brain is so delicate. The tissue of the brain is so frail that it feels soft and spongy, and it can get injured really easy. Oh! That is horrible and awful. Somebody comes to the hospital with open pieces of the brain. Obviously, our job is to stop the bleeding. We'll probably put wraps around it that are actually wet. That way the gauze doesn't actually stick to that area. You're gonna get a CT scan of the brain. You're gonna call a neurosurgeon, and you're gonna transfer, if you're not at a trauma center, to a trauma center.
Hey, you're a good swimmer. Go get it.
What? But Dad!
And for God's sake, do not be afraid to make me a sandwich while you're in there.
Oh my gosh. Get out of the house. Risk of electrocution with all the appliances. It's just a dangerous situation. Get out of there. You don't know what might be lurking in the water. Different infections could occur in situations where there's stagnant water.
She's in there right now, taking a nap underwater.
For God's sake, save her!
My God, we better get her to a hospital.
Oh my gosh. Okay, possibly a near drowning. So drowning versus near drowning. Near drowning means that you almost succumb to your injuries due to water. Drowning means that you have died. Good, protect the head, but if she's not breathing, you need to be doing CPR. Mouth to mouth. There are instances where you do hands only CPR, but in this instance, you're trying to clear the airway of the water and get it out of there.
Mr. and Mrs. Griffin, I'm afraid your coma's in a daughter.
I mean, your daughter's in a coma.
Oh my gosh, sometimes as doctors, we just say the wrong things at the wrong time. If you go to the emergency department and you're not breathing due to water, you're gonna have CPR. And now you're worried about secondary effects of all the fluid that were in the lung. It can cause a significant amount of edema, swelling, also can cause reshifting of fluids and electrolytes.
Well, I am gonna change. You hear me, Meg? If you come out of this, I am gonna treat you like a princess for the rest of your life.
So very interesting. Peter talking to Meg bedside. I literally tell patients to do that. They'll ask, can the patient hear me? Do they know? I don't know 100% of the time. A lot of times individuals who have been sedated will tell us that they do remember certain events. Oh, waking up. Nice.
Wow. Hello, sleepyhead.
A lot of times patients, family members want to stay in the hospital, sleep in the hospital. There are kind of rules about that, unless it's a situation potentially where it's like life and death. And the reason for this is the staff is there to take care of a patient. And if there's a lot of extra people, it reduces the care that they end up getting.
Model glue, sir.
Well, what do we have today?
Today, we have a recent vintage procured just this morning from Michael's hobby shop.
Yes, that's very nice. Bring me my finest rag.
Your fancy rag, sir.
You are relieved for the evening.
What? That is so messed up. Oh my gosh. That is awful. Sniffing glue, sniffing, huffing, bagging. These all, fall under a very similar category. And it is so bad for us. It could be an acute bad, it could be long-term bad, but what ends up happening is you can cause brain damage, brain death. You're going to cause issues where the myelin sheath, which is the coating over top of your nerves in your brain, get demyelinated, and it actually almost misbehaves, like you have multiple sclerosis. You can die from cardiac arrhythmias, you can die from asphyxiation or hypoxia and respiratory failure. Not the right way to go, so don't do it, please.
Still on those meds, huh?
Yeah, they helped me to, think.
You've heard the names of, say, Adderall or Ritalin. They're a little bit different medications, but they're a type of stimulant to help people focus.
Okay, time for an eyes open nap.
Stewie's eyes are wide open. You can see the white all the way around, say, the iris and the pupil. You get concerned actually with other medical problems relating to your thyroid, where the eyeballs might be pushing out and you actually might have hyperthyroidism.
Putting you on that stuff was a huge mistake. See, this is how American society treats unique, enthusiastic children. Instead of embracing their mental gifts, their first reaction is to shoot them up with hardcore drugs until they're mindless sheeple.
Yep, takes all kinds.
To diagnose somebody with these type of medical ailments or disorders is done at a younger age when people are very active and they have creative minds. So it's hard to really determine does somebody actually need this or not. There's specific criteria.
You know, a lot of kids in my school take ADD pills. They say if you're lazy and unmotivated, it makes you super energized and productive.
Really? Productive?
ADHD, right? We don't use ADD anymore, we use ADHD. Attention deficit hyperactivity disorder. Not something that is typically diagnosed in the emergency department, but we do see people on these medications.
Focus, huh?
Oh, geez.
Okay, well, Stewie, these babies can help the garbage disposal focus, because that's where they're going. No need to follow me, because I just said what I was going to do.
Disposal of medications, the most appropriate thing to do is actually just bring them back to the pharmacy and they can dispose of them. You got to be careful flushing them down the toilet. Depending on where you live, it may go into water supplies.
Time's almost up, Peter. We're gonna win.
No, we're not.
And in a stunning turn of events, Chef Griffin is eating his entire meal.
Peter ate a ton all very quickly, having a poor diet over a long period of time, smoking, uncontrolled hypertension, diabetes. A lot of these risk factors of family history play in part to how likely you may in the future have a heart attack or stroke.
You threw the cook off for me?
I couldn't take your dream away. Heart attack from you, buddy. You're the mini stroke with the real heart attack talent.
So every time he says he's having a heart attack, he's having chest pain, right? There's no way to actually know in that moment if you're having a heart attack. A heart attack basically is a blocked blood vessel around the heart. Typically a very small plaque that becomes like a clot real quick. Then you decrease blood flow and you get pain to that area.
Your heart attack deserved the show. Regular stroke, not me.
You're a good friend, Peter.
Stroke symptoms usually are one-sided because we have two halves of our brain. Stroke hitting the left part of our brain will affect the right side of our body and vice versa. And then also the balance center of our brain, your cerebellum, has to do with like balance and dizziness.
This place is paying Meg to do what?
Nothing. When you have 1 million followers, people just pay you to hang out.
No, that doesn't happen. I have 1 million+ YouTube subscribers on the channel at the moment, and no, I do not get paid to randomly hang out. Shout out to you guys for subscribing to this channel.
Yo, yo, yo! Everything here is made with corn syrup. Just drink the corn syrup!
Please do not just drink corn syrup. High fructose corn syrup, basically what we add into a lot of things, especially here in the United States, to make things sweet for the sugar purposes. Oh my gosh. So Meg collapsed because of blood sugar being super high. Blood sugar can normally range in a normal person with a normal functioning pancreas and insulin production between 70 and 100, 110. Once things start getting higher than that, then they're concerned for diabetes.
Meg has type 2 diabetes.
Type 2 diabetes is basically you're not born with diabetes and you've put your body into such a situation where you've taxed it so much over time. Having high amounts of sugar in your body has significantly impaired your ability to manage the elevated blood sugars.
I need to draw a little more blood for the lab.
Oh my gosh. We don't actually typically put spouts into people. Obviously, we put IVs in. There are some type of devices that we'll put into people where if there's fluid in the lung,
He's got fluid.
put a chest tube in that has a valve on it. If you have too much fluid in your brain, you can actually put a shunt in where you drain fluid out and you can adjust the valve as well.
As I suspected. Sap.
Typically, people will put these type of devices into a type of tree to get syrup out of them.
I want to be picked up now, Mom. Fine, I'll see you at 4. What do you want?
Oh my gosh.
I have no idea what's going on.
Allergic reaction.
I feel like I'm turning back into my old teenage self, and there's nothing I can do about it.
Lois is stressing out, a lot of anxiety, and she has a rash. So this rash could be brought on by stress and get hives. Typically, if you treat the offending problem, control the anxiety, this will go away.
I see. Did you recently run into an old bully, or were you tagged in a very unflattering Throwback Thursday photo?
Wow. In the emergency department, if somebody comes in with an allergic type reaction, we give steroids, Benadryl, Pepsid, fluids, plus or minus an EpiPen. Just depends on the extent, and we're actually just trying to get the body to stop having an overreaction.
I did. I ran into a girl who terrorized me in junior high, and she used to call me Scully Lois.
Like scoliosis. That's very good.
Oh my gosh. So she's in a type of brace that's keeping her upright, all the way down from the lower back all the way to the neck. Look at that neck! This could be a type of scoliosis brace. You can also use this type of brace for different types of spine or vertebral fractures to keep in alignment.
Dr. Hartman, what's happening to me?
Well, Mrs. Griffin, I think you're suffering from severe nerd damage.
Severe nerd damage.
I'm a nerd.
I guess I have that too. But no, maybe nerve damage or autoimmune type reaction due to stress.
You see, all nerds are one tossed-off joke away from reverting to their worst, most humiliating selves.
But I don't want to be a nerd forever.
Tell you what, find the coolest guy in school and give him a tug behind the bleachers. That usually solves it.
Oh my gosh, no. She also has an eye twitch on the left eye, and that could also be related to muscle spasming, stress. Just like you'd have a cramp in a leg, you can have a cramp in the eyelids. There's multiple different muscles that affect that eye as well as nerves.
Does that really work?
I don't know. Why don't we go find out?
Oh my gosh, Dr. Hartman totally inappropriately hitting on his patient. There's no right scenario where a doctor should be dating a patient.
Ooh, the siren song of the unattended. Whole grapes.
We won't choke you.
Sometimes actually when you swallow a grape and it goes into your esophagus, if you didn't actually chew it well, it feels like it's stuck in your airway, but more in the sense of it's pushing on the trachea, giving you that sensation. Oh my gosh. Classic universal sign of I'm choking. Stewie's doing it right there. Now it's in his airway. You typically would go up to the individual and say, hey, are you choking? Are you choking? And then they're going to give you yes. Can I give you the Heimlich maneuver? If you want to see an exact video how to do this, I made a video with Jen. We'll put a link in the description below so you can check it out.
You should have sliced us, skinned us, cut us. Now you have no air.
Very good. You're seeing tracheal rings. You can see those circles all the way around. So that's different cartilage that gives the structure of the trachea to keep it open. When we sometimes do an intubation, we can actually put a bougie, a plastic type straw down into the airway, and it has a little hockey stick at the end. It actually angles up, and you can actually feel the tracheal rings.
Feel it, feel it.
Oh my God, Stewie!
And yes, classically somebody would be turning blue, and that just has to do with the fact that you're not getting good oxygen to your tissues.
You're choking!
There it is. Meg appropriately did the Heimlich maneuver. Basically, you're doing abdominal thrusts where you're right behind the individual. You're thrusting just below the ribs and pushing inward and upward because you're trying to expel that grape out of there.
Meg, you saved me.
When it comes to infants, you would actually do chest thrust and you'd actually hold the individual baby down and then you actually flip them over and do hits to the back gently to try to get it out.
I think you can do that and a whole lot more.
Oh my God, that is not what a testicle is supposed to look like.
Individuals that have testicles should be doing at least weekly exams on themselves to check the testicle and make sure that there's no abnormal growths, lumps, pain, anything weird.
Mr. Griffin, I'm afraid you have testicular cancer.
Oh no, okay. The earlier that you catch any type of cancer, the better the outcome is going to be. If you wait and delay, things can spread throughout your whole body and then you are a ticking time bomb.
We're a time bomb.
I'm sorry, there's nothing I can do.
Oh, I think maybe there is.
If you keep doing that, you're gonna pop it.
Typically, if you're going to pop something in our body, it's usually something that's fluid-filled. Testicular tumors and cancers can be fluid-filled, but typically it's an abnormal growth of tissue.
God bless you.
Then, unfortunately, it starts to metastasize to other parts of our bodies.
Stand back, Brian. I'm preparing for my vault.
You can't vault inside the living room. You're gonna get hurt.
Yeah, I'll get hurt right onto a Wheaties box.
Wheaties is the type of cereal that's not the best tasting. It's notoriously known for putting athletes on the box. Oh! Anybody out there ever have a gymnastics situation gone wrong, either home or at the gym? Let me know in the comments.
I think I'm okay.
Whoa!
Uh-oh!
Hopefully this piece of glass only went so far as touching the soft tissue and not anything deeper. We'll do some imaging anyway because sometimes glass will be embedded in different areas and you can't see it.
Uh-oh! Uh-oh! Oh God! Somebody!
With lacerations and injuries to the face like this, we typically use sutures because we want to use the smallest possible material we can use. And typically you're only leaving stitches into somebody's face maybe 5 to 7 days at most.
Do I take it out or do I leave it in? Do I take it out or do I leave it in? Ah!
What would Dr. Wagner say? Don't pull it out, stabilize it, get to the hospital ASAP. There are some major blood vessels in the forehead that bleed like stink, so that's why you don't want to remove it right away because you might bleed a ton before you even get into the hospital.
What the hell?
Uh-oh, Peter, maybe you better take a break from yelling for a bit.
No, it's fine. Don't throw it to Griffin. She said...
The loss of voice, laryngitis, inflammation of the larynx, non-specific inflammation, which then doesn't allow your vocal cords to reverberate and vibrate as they normally would to get phonation out, to get the sound out.
Are you gonna help us? He's barely been able to speak.
He needs to rest his voice. He absolutely must not talk for at least a week. If he tries to speak too soon, he could damage his vocal cords and lose his voice forever.
Oh my God.
So you want to relax.
Just relax.
Your vocal cords because there's inflammation, so you don't want to use them. It's like anything where you strain a muscle in your body, you don't just keep using it, you need to have time for it to recover. Oh, he's writing.
What is it? Is he trying to say something?
No, he just wanted to show me he threw a Garfield.
Singers get this a lot where you can actually get some like growths on the vocal cords.
I am living with notes.
There's a lot of different things that could occur, but most commonly it's just inflammation. Could be just from overuse. Definitely get checked out, have somebody take a look at it, especially if it's going on longer than a few days.
I'm checking to see if WebMD can help us, Stewie.
WebMD, actually not a bad place to start, just not a place to finish. You can bring up different diagnoses that you might have come up with to your physician just to make awareness, because sometimes the doctor isn't thinking about the super obscure things.
Okay, here it is. Multiple personality disorder. See also cuckoo for Cocoa Puffs.
Sounds like this Stewie mope is gonna have a heart attack.
Well, what used to be multiple personalities is now actually a new term, which is called dissociative identity disorder. It's not actually something that we see very often in the emergency department.
Okay, it says here that the first thing I need to do is talk to the dominant personality. Is that Mrs. Padbury Wilkerson?
One moment, I think you want Rick. Hi, I'm Rick.
Typically in the emergency department, when it comes to mental health, we see people who have suicidal thoughts, obviously anxiety, depression. We see people who are more manic when it comes to bipolar, and we also see a lot of people who are schizophrenic that are maybe having an episode because they might not be on their medications.
Hey, Rick. Oh, ow! What the hell, Stewie? It's Rick!
I'm just your average guy who likes to beat up dogs because it makes me feel in control when my wife and 3 daughters emasculate me.
Punching somebody in the face with your bare hands is actually going to cause a lot of trauma to your own hands, so I highly advise not to do that. You can break different parts of the jaw as well as the maxilla and the nose. Wow.
Stop Ah, wait! I want Mrs. Padbury Wilkerson back!
We have a black eye depicted by basically the graying out of the eyelids. The biggest thing we see with that is it bleeds a lot around the eyes, so you get a lot of pooling of blood, and typically it'll actually come down and pool below. That is normal, and then it'll eventually go away.
Sorry, Mrs. Padbury Wilkerson is in the loo! Ah! Bring back that southern guy! Sorry, I'm busy watching Mrs. Padbury Wilkerson use the John.
By definition, this disorder is basically 2 or more different personality states that are typically brought on by previous traumas. My 14 plus years being an ER doctor, I have not actually seen somebody come to the emergency department with this type of dissociative identity disorder.
I'm gonna be a surrogate.
But don't you need an egg?
Jeffrey and Bruce already picked out an egg donor from a website.
Surrogacy, it's a legal arrangement. The pregnancy will grow inside the uterus of this other individual. And then once the baby's delivered, it's given to the couple or the family that had this process started.
You can just get hot eggs off the internet? What website?
There are different ways you can go about fertilizing an egg. I'm assuming there's a donor egg and a donor sperm that might be fertilized elsewhere and then just implanted versus surrogate eggs.
Meg, this is serious. Pregnancy is not something you do for money or to keep a certain professional athlete interested after he blocks your number.
Oh, man. As an emergency medicine doctor, don't go down this road. But if somebody were to come to the emergency department that has any complications relating to pregnancy, typically they come to the emergency department for bleeding or pain, and we're doing ultrasounds, blood work.
Dang, no more sush for Meg for 9 whole months.
That's honestly what you're taking away from all this?
Well, yeah, I'm still getting sush. Anyone else for sush? Dad sush?
Stewie is talking about sushi. Because sushi is raw fish, it increases the risk of microorganisms like bacteria and parasites. There's a lot of foods out there that they do suggest to try to avoid to reduce any risk.
It's on the bad food list you gave me.
Oh, this is embarrassing. We wore the same thing. Let it be noted that I was the one to change this time.
I highly recommend not going into the hospital barefoot. Yes, they do a good job of cleaning it and sanitizing it, but it's a high concentration of germs. So you need to just make sure that you're not increasing that or taking it with you, so to speak.
The fertilization of the hella more attractive egg was a success.
Brucey, we did it!
Yeah, so now we just have to implant that very hot embryo into Meg's body.
Is this gonna hurt?
Not at all. Nurse, wheel in the implantation cannon.
What? Dr. Hartman behaving as an OBGYN. Now, he's a family medicine doctor, I believe. They can do these types of potential procedures if they're trained that way, but I would recommend going to an OBGYN that specializes in fertility medicine.
You guys are going to love this thing. A clown died in there, but I think we got them all out.
I have delivered many babies. When I'm delivering a baby, it's due to the fact that it's an emergency and the baby's trying to come out and see the world ASAP.
See world? Oh, awesome. Look over there. You can take a selfie in a hospital bed to get social media attention.
Come on! A long time ago, when they didn't really understand the effects of cell phones, you weren't allowed to have cell phones in certain areas. Nowadays, they've found that cell phone signal doesn't necessarily interrupt the machines that we use at the hospital, so that's relatively okay.
Don't really want to get into it, but I'm fine. This is the last thing I wanted.
I definitely see people who do come to the emergency department, take lots of photos in there. As long as you're not taking photos of the staff and equipment and you have permission, I don't see a big problem with it, but it has to be done under the right circumstances. You can't be taking photos of other people.
Well, from this day forward, I, Peter Griffin, will never drink again.
Nice, Peter Griffin.
Nice.
Talking about alcohol, it's a legal substance. We know alcohol affects your liver. There's really not any benefit to alcohol. We used to learn that it might have antioxidants relating to red wine, but you have to drink a lot of red wine to get the benefits of the antioxidants.
Look, doing is not the way to stop drinking. You need to get to the heart of why you feel the need to drink in the first place.
A lot of people have addictive personalities. They may find that they get addicted to one thing and everything else is good, but then when they stop that addiction, they still have this impulse that they have to have something, and so they switch different addictions.
Hey, Peter, just thought I'd check on you. Oh, my God!
Oh,
Government came and took my baby!
Have people come to the emergency department where they look like they're tripping like Peter is? Yes.
Yes.
For multiple different reasons. People can have acute psychosis for not just medical reasons, psychiatric reasons, but also substance abuse reasons.
All right, let's see what we have here. Oh, the baby's crowning.
If the baby is being delivered, typically you're actually in a sterile gown and sterile gloves. And when they describe that the baby is crowning, that means you're starting to see the head of the baby come out.
Well, these don't feel like gloves at all.
This is a
They feel like
biohazard.
used needles.
Yep. Oh
Well,
my
this is
gosh,
where
she's
I
gonna
always
come
keep
out
the
with a
gloves.
handful of needles. You don't have the biohazard needle bin there. It's got specific devices to prevent your hand from going in, from needles and anything sharp coming back out.
Oh, maybe if I dig deeper.
Ah.
It just feels like more needles. Well, that's the craziest thing. Oh, now I'm sure this isn't the glove drawer.
Oh my gosh. There's no way to know what type of exposure this is. You need to go down the route of, do you put somebody on medications to prevent any transmission of viral illnesses? Potentially, yes.
Oh my God, who's gonna deliver my baby? Honey, do something.
Then leave Dr. Hartman on the ground, most likely passed out. Most of the time, delivering babies is quite simple.
It's easy, you just catch.
Sometimes there are complications, very anxiety provoking, a lot of adrenaline going around, but they just make their way out.
No baby, but it looks like Carol's blowing a bubble.
Peter, that's the head.
Some babies come out bald, some babies come out with a full head of hair, so it just depends.
Oh my God.
What? What?
It's a beautiful baby girl.
Oh, a baby girl. I'm so happy.
But she has a penis. Well, we'll have to do something about that.
Peter, no, it's a boy.
Oh, the baby doesn't come out so clean. It's got a lot of white material all over. You gotta clean out the airway. You gotta warm the baby because the baby now just came out into the cold air and it's gonna be freezing. And then you give the baby back to the mother.
Hey, Peter.
Yeah?
Pillow fight!
Ow, you bastard!
Okay, who's had a pillow fight? Everybody's had a pillow fight. Just gotta be careful not to actually like literally hurt yourselves. There's a lot of trauma can happen. That escalated fast.
That escalated quickly.
Anybody have any of those friends out there, you do something where you might have hurt them on accident and then they hurt you like 10 times more? Let me know in the comments. You got the black eye there. Usually you can have a black eye at the top here, but then the blood will actually seep down and get down low here. A lot of different things can cause it, but it typically seeps down just below the eye just because of the gravitational pull, so to speak. Oh, now we started vomiting. The thing you think of as a doc outside of alcohol, maybe consumption, traumatic head injury, intracranial pressure.
Oh my God, sorry, Lois.
Oh, even Lois has got a bloody nose. Ouch. Bloody nose, grab it, lean forward, get the bleeding to stop.
Peter, what is our infant son doing up on the roof?
There's a raccoon up here!
Kids definitely should not be on the roof, especially Stewie, who's an infant. You should make sure that you lock any access to roofs. If Stewie were to fall off a roof, that is very high compared to his height, which would lead to a major trauma.
Chris, where the hell are we?
I told you, Doug. This is the bacon factory.
Doug.
Doctor, I need you to get rid of this zit.
You traitor!
What is a zit? Increase in oils of the skin that might get trapped underneath. It can form a small little pocket of pus or a pustule. I deal with these in the emergency department when they become more like an abscess.
Oh, that's a doozy. I bet some of those awful kids at school call you Zit Face.
No.
Papa Zit.
No.
Pus Peak.
No.
Fat.
Oh, yeah.
Oh, that's terrible.
What do you guys call pimples? Let me know in the comments. I didn't hear about half of these ever in my life.
Well, we're going to have to use some cortisone on that.
Ah, so this is actually pretty good. Cortisone is a type of steroid. Steroids to decrease inflammation.
Oh, yeah? Who can play that game?
Where did you get a gun from? Oh. It doesn't go away that fast. It will help it go away. Sometimes it increases the risk of getting infection. Just something to be aware of.
You okay, Fat?
Whoa! Doctors calling your patients names. No, you cannot do that.
Ryan, your blood work shows that your liver isn't functioning properly.
There's lots of different liver function tests that we do. We're looking at your AST and your ALT, your different blood coagulation levels, as well as some more in-depth blood tests.
Would you happen to be a drinker?
The liver helps process toxins in our bodies. We know that if you drink too much alcohol, it causes issues relating to damage to your liver, leading to cirrhosis. But there are a lot of other things out there that can cause cause your liver function test to go high.
Well, I don't know if I'd label myself a drinker. I know I like a cold beer after I mow the lawn.
There were 3 lies in that sentence.
Be honest with your doctors if you're ever going to the doctor about how much you drink. You can't really hide it from the doctor. You can also test alcohol levels even if you're currently drinking.
Brian, have you ever heard of Lou Gehrig's disease?
So Lou Gehrig's disease is also called ALS. It is a nervous system disease that weakens muscles and impacts physical function. It's typically kind of from the top down.
Well, you have Mickey Mantle's disease.
Mickey Mantle has been treated for alcoholism, so he's trying to tell Brian that he's an alcoholic. We've actually determined scientifically that there is really no true health benefit to alcohol. So just be aware of that. Every time you're putting it in your body, it is like a toxin.
Now, the most obvious step would simply be to stop drinking.
We do have medications to help that. Benzodiazepines, sometimes we use Librium. A lot of this needs to be monitored by your doctor.
Or, well, we do have these pills that may correct the enzyme imbalance in your liver.
If somebody's an alcoholic and they drink every day, quitting drinking right away could be dangerous, can set off alcohol withdrawal syndrome, hypertension, tachycardia, shakiness, which could also lead to seizures and could lead to death.
Yeah, that one. Okay, I'll be in the waiting room barking at the fish in the tank.
If you're just the occasional social drinker, but you don't want to wake up feeling bad the next day, I've created a supplement called Poor Decisions.
All right, Mr. Griffin, these pills will clear up Brian's condition. But unfortunately, they only come in suppository form.
Suppository meaning a medication that needs to go into your rectum, through the anus, so that way they get absorbed down there. Sometimes suppositories are better. If you're vomiting and you can't actually ingest anything, this is a way to get it into your body. And it also has first-line pass into the liver.
It's nice to watch TV when you have nothing else to do, isn't it?
Yeah.
Get over here, you idiot! Peter, what the hell? I'm still in charge of you! Stop it! I'm a human!
Get away from me!
This is for your benefit, so just go limp and
You
take
touch
it.
my ass! I swear to God, I'll kill you!
You can't really force patients to take medication. The only time that really does occur is if the individual is a danger to themselves or a danger to others and you're actually trying to help them. Oh!
What the hell? You bit me!
We get a lot of people that come to the emergency department for dog bite injuries, and we worry about infections because of the puncture wounds. Obviously, we'll close up any wounds if they're gaping. If they're just slightly open, sometimes we leave them open to prevent infection.
Holy crap, a vintage Mr. Potato Head from the good old days when potatoes were men and had penises.
What does that even mean?
That's the very potato I used in medical school to learn anatomy. I could let it go for $600.
In medical school, when you're actually studying human anatomy, you're doing a cadaveric lab, so you're doing dissections. In the med school that I went to, we actually had 4 individuals to a single cadaver.
We don't have that kind of money.
Fine, I'll buy it with my magic beans.
Those are Skittles.
Pretty intense anatomy in medical school, not where you would use Mr. Potato Head.
I wish I had a jetpack. My life would be better.
Oh, geez, dangerous.
Oh, 360.
360 pounds, not good. Carrying that much weight increases cardiovascular risk of death. So please be aware of that. Eating healthy, losing weight are things that we can do, as well as exercise.
Oh, wait, 180.
Every time you go to a doctor's office, even the ER too, we need a height and a weight. And the reason for this is it's helpful for us with medications because there's a lot of weight-based medications. A lot of them are milligram per kilogram.
Very good. Now let's get your height. All right, so you're 7'6", 180 with colorectal cancer.
I'm tall?
Oh my gosh. Colorectal cancer, colon, rectum. These are cancers that we can screen for doing a colonoscopy, which is highly recommended, especially here in the United States. Make sure that you get them. They've actually lowered the age to 45 to start screening. If you can catch it early, it is quite treatable.
Okay, here it comes.
Oh my God! He farted, right? Sounded like he had a fart. So either had diarrhea or bloody diarrhea. Sometimes people are so worried that they have blood in their stool, but it's just a fissure, which is just a cut in the anus, or an internal or external hemorrhoid, because they both can bleed, but internal ones bleed a lot.
Peter, what's wrong with you?
The big bleeds that we worry about is when it's mixed in with the stool, not necessarily on the outside of the stool, but if it's mixed in or if it's all blood, not good. Typically, if you have blood in your intestine, in your colon, the intestines don't like it, so they're actually going to cause you to have diarrhea and get it out.
Brown? Oh, gross, like pee?
If somebody is bleeding bright red and they had a peptic ulcer, the person may not have a very much longer time period to live because they're bleeding out so quickly. So very much an emergency. That's when we call a GI specialist, a gastroenterologist, to come emergently do an upper endoscopy and see if there's a source of the bleeding that they can stop.
Okay, guys, now you're gonna do a synchronized duet of making whoopee while I shoot you with this BB gun.
Please be careful. BB guns are quite dangerous.
The BB gun.
I've actually seen BBs go through people's skin and get stuck under there or get stuck into their soft tissue and you can't get them out and then you have to be stuck with them for a while.
Hey, Joe, open your eye.
I've actually seen people get shot in the eyeball with a BB. You can actually go blind. When it ruptures the globe, all the fluid of the eye gets squished out of there. The concern is the optic nerve being damaged as well as the retina, which is the area in the backs of the eye that help us see.
You know, Peter, you used to be a great guy, but ever since you won that lottery...
Hitting somebody in the throat like that, super small, could it go through the airway? Maybe if there was enough force, but you're also causing a little bit of trauma and swelling to this area. So if you're actually hitting the airway and your vocal cords, it could potentially cause swelling on the inside and actually cause the airway to close up.
I'm tangled. I'm tangled in your wallet chains. Stop.
Oh my gosh, who remembers wallet chains? I don't know if they're a thing anymore. I think my older brother still uses one.
I can't feel my arms. One of you tattooed Betty Boop ladies, help me.
Oh my gosh, come on.
Come on.
Do we get instances where people come to the emergency department where they get simple things wrapped around a part of their body part which causes an issue? Yes. Something that's quite common is something called a hair tourniquet. It happens in little kids where the hair actually wraps around like your finger or toe. Sometimes we'll actually use Nair, which helps remove hair, so it actually breaks down the hair itself.
Hi, I'm the lead singer of the Cherry Poppin' Daddies. My name doesn't matter. Please, don't wear wallet chains to our shows. Otherwise, you could end up with both arms ripped off like this guy.
Wow. In this circumstance, could you actually rip somebody's arms out? Potentially, especially at like joints. If the joint is able to be dislocated, that joint can be ruptured in the sense that like the ligamentous attachment will be pulled apart.
Peter?
Uh-oh.
Oh, Peter, thank God you're awake.
Well, what happened?
This should explain everything.
Farewell to arms. Oh my gosh. Can you put those arms back on? If you have the arms and it's a very clean cut and you have the anatomy there to be able to do it, there's a potential.
We couldn't reattach your arms.
Oh my God!
Don't worry, they'll grow back. Just spread the seeds on, keep them watered, and watch them grow.
Come on.
Come on!
Wait a minute, why are they removed at the shoulders, first off? Because that's not where the injury was. They were pretty much like mid-arm. All I can think about is Ryan Reynolds and Deadpool. This is the same thing.
Peter!
Chia.
Oh my
See,
god.
they're already coming in.
There are individuals out there that do have their hands proximally attached like that due to multiple different reasons, and they actually have the ability to function normally, and they actually are thriving.
You see, Kev? Nothing's gonna stop you in the real world except for your own cardiovascular system.
Hey, I'm only heavy because Adam Sandler made me gain 60 pounds to be in his movies.
So that's supposed to be Kevin James. Yes, so if you are overweight, it increases risk of cardiovascular disease. So sometimes you could say, oh, I'm healthy now, my blood work looks perfect, but it just increases demand on your system.
Demand suddenly skyrocketed.
Oh.
Ah, what happened to your hand?
I don't know.
Let me guess. One of you chuckleheads has a nutcracker inside you.
What? No.
Hi, we're non-judgmental interns, just here to observe.
False alarm, not what I thought.
Oh my god. Not cool at all. If you go to a teaching hospital, an attending physician might have on their team residents, interns, medical students, even pre-med students observing. And there are times when patients will say, oh, I don't want that. Oh.
Kevin, your arm. It's getting worse.
I think I see what's going on here. Kevin is fading away because streaming has made him irrelevant. Sitcom stars like Kevin clearly need the laughs of a studio audience, or he may disappear forever.
His hair was disappearing too, but I assume he took care of that another way.
Typically, hair loss, it happens as we get older, and that's normal, but sometimes people have early hair loss or male pattern baldness or alopecia. There are different things that you can do. Hair transplants, you can use different topical medications, you can use oral medications.
Oh my God! Hey, could you close the gate? A couple of calves got loose. Pow!
Pow! Looking pretty jacked and ripped. At first I was confused about the nipples.
Nipple confusion.
I don't know dog anatomy well, but I didn't know that male dogs had that many nipples as well. Let me know.
What does your girlfriend think of this? I dumped her. She couldn't keep up with me. Hey, grab me some more Band-Aids, will you? I got like 8 more nipples to cover up before my run.
So, I don't know if any of you out there are runners, marathon runners, but typically people will cover up their nipples with Band-Aids due to the chafing that could occur from your shirt, rubbing against it, and actually can cause bleeding, it can cause cracking of the nipples, some dry skin, really irritated, so that's why people do that.
Whatever you're doing, it isn't healthy, Brian. Oh, I'm not healthy? Stewie, my heart rate is down to 4 beats a minute.
4 beats a minute is not sustainable with life. He's dead, Jim. I don't care what animal you are. No. A typical human heartbeat is anywhere between 60 to 90. Once it starts getting over 90 into 100, we call it tachycardia. When it starts getting below 60, we actually call it bradycardia.
Brian, I think you've taken all of this too far. You know, there is such a thing as too much exercise. Stewie, I know you're worried, all right? And no offense, but I'm not taking advice from a guy who eats bread.
Bread makes you fat?
I mean, bread is good if you eat the appropriate bread and you're not eating it all the time. You know, you really want to stay away from refined carbohydrates, a lot of sugars, but like fruits and vegetables are fine. Not ready for that. Holy cow. Obviously, the anatomy is not perfect. Lower extremity anatomy below the knee would be made up of your tibia and your fibula, but there's no fibula here. The fibula is a structural bone that runs along the side of it, makes up the outer ankle and the little bump on the outside of your knee.
Peter, I'd like to introduce the surgeon who will perform your procedure today. Dr. Wang Gan.
Dr. Wang Gan. They're alluding to potentially the surgery that Peter is having. They're doing procedures nowadays that could adjust the physical anatomy. That is not my expertise or specialty.
Where do you think you're going? Doc, I'm not actually going through with the operation. I'm going home. We're doing this whether you like it or not.
Doctors cannot assault individuals. We get into situations where family members really don't want us to let somebody go home, but if somebody is of sound mind and can understand the consequences of their actions and is not endangering anybody, we cannot hold people against their will.
No, stop him!
And so he's got a scalpel that almost looks like a 10 or 15 blade, probably a 10 blade. The 11 blade is what we would use more often in the emergency department. We would use that to maybe cut open an abscess or help put in central lines that we need.
Yeah, well, you know what else takes years of specialized training? Crossing your eyes.
Whoa!
Too far! Too far!
Who can cross their eyes out there? I can. You ever hear like, don't cross your eyes and somebody slap you in the back and you end up permanently that way? Yes, that's not true.
Hold still.
Yes, you couldn't get your pupil to go to the other side, but you can get different size pupils. That's called anisocoria. You can have that typically with increased pressures of the brain and then other ocular dysfunctions, the pupillary reflex that is abnormal.
Thank you, Korean sweatshop animator. You've earned your nickel this week.
There's something super rare called polychoria, where you have 2 working pupils in the same eye. I've never seen that.
All right, that's it. We got to do something about this. We have got to get that record and destroy it.
We got loud, weird music playing, and Stewie starts having a nosebleed. Could that happen? Probably not. If you start having a nosebleed, pinch your nostrils in the front and lean forward.
Just like that fat person's surgery destroyed Star Jones's arms.
I look so good. I lost all this weight. Taxi! Coming to show people how good I look.
Sometimes with different types of bariatric surgeries for weight loss, the weight loss is so fast that the skin that has been stretched out to hold that weight doesn't have enough time to slowly regress back.
Meg,
Meg, oh my God, it's crazy here. Dad fell off the pole and landed on his head, and one of his eyes popped out. We picked it up and jammed it back in, but the pupil was on the other side. Okay, just got a little headache.
That would be a good treatment potentially for if a tooth falls out. Really difficult to put an eyeball back in, especially if it's totally out and you don't have the connections anymore. Remember, the eyeball has 6 muscles plus the attachment of the optic nerve, so there's 7 different attachments.
Just got a little headache. Also, Dad gave me a hard lemonade. He's pretty out of it.
You saw the redness around the white of the eye. The white of the eye is called the sclera, and when you have that redness in those blood vessels that are a little bit more fiery, we call that injection.
Coward! I have found you!
Oh my gosh! We have a single bullet injury. It's obviously a through and through to the shoulder. Unlikely that it hit the bone because the bone would likely change the trajectory of the bullet if it's going through and through versus just through the soft tissue. What the? Hit Meg in the head, directly in the forehead, through the skull, into the brain tissue. Somebody gets a bullet shot to the head. Doesn't necessarily mean they succumb to the injury. Call 911 right away.
Quick, somebody call an ambulance. This could need stitches. We don't want this to leave a scar.
No, there's no time for an ambulance. We gotta take him to the hospital right away.
I think the smarter thing would be to call an ambulance because most of the time, at least here in the United States, an ambulance will get to you between 2 and 5 minutes. It's pretty darn fast. God forbid there's something happens along the way to the hospital. At least if you're in the back of the ambulance, they can do something.
Guys, I'm all right. I think Meg...
Oh my God, he's delirious. He's talking nonsense. Quick, everybody in the car.
That's so messed up. In Meg's case, you worry about airway compromise, so you probably intubate the individual, especially if they are still breathing and they still have a pulse. You want to control that because you're worried about brain swelling and the possibility of losing an airway.
Sir, I think you should know these growths on your forearms. They're giant tumors.
Oh my gosh, it's Popeye. But it's funny that he's always known for these big, huge forearms. Tumors don't present this way. The tumors would be probably asymmetrical and they wouldn't be bilateral like that.
And the speech thing and what you're doing with your eye? You had a stroke about 7 years ago.
Typically, a stroke would spare the ability to lift your eyebrow. So if somebody comes in and they can't lift their eyebrow on the same side where they're having a facial droop, the likelihood is that they are having Bell's palsy.
That you've managed to be walking around all this time is nothing short of a miracle. I'd say about 2 months.
If somebody in your life has stroke-like symptoms, get them to the hospital ASAP. Within a 3-hour window of the onset of symptoms, or 4.5 depending on certain criteria, we can give a medication systemically in an IV that will break up a clot that might be causing this.
Oh, Peter.
Oh, Lois, I missed you. You and your wonderful smile and your beautiful eyes and your awesome third boob that's on top of the other boob.
What?
What?
Oh my God. Peter, that's not a boob. That's a lump.
It's really important to do breast exams, feel your tissue, and make sure that you're not feeling any abnormalities. You should be doing this in the shower. You're palpating and then going out in a circular fashion to hit the whole breast so you don't miss any area.
Mrs. Griffin, I've got good news. Your test results came back negative.
People will come to the emergency department immediately to get evaluated. You can do an ultrasound to make sure that there's no sign of like an abscess, but you need a mammogram, and then after the mammogram, if there's a lump in that area, then you're going to potentially need a fine needle biopsy or potentially a little bit larger biopsy.
It appears the lump in your breast is not black gross boob death.
Breast cancer?
That's the layman's term, yes.
Oh, thank God.
Black gross boob death is not a current medical term that we use. We'll say cancer, tumors, mass in a cancer diagnosis rule out situation. You just want to be straightforward. You don't want to try to be funny.
What a relief.
Yeah, that was scary.
If you find yourself in a situation like this where you're facing the occasional stresses, I want you to check out my formulated supplement called Chillax to help calm the body and the mind to bring those chill vibes.
Now, Mrs. Griffin, although you're in the clear for the moment, we need to have a look at your family medical history to determine your future risk.
Family histories are very important. We ask about family histories because we want to know, is there increased risk? Are there anybody else in the family that died of different types of cancers or that specific type of cancer that you're worried about? Oh! I didn't count how many bullets went through the thorax, but a lot. Now, I've been in situations where somebody has gotten a lot of bullets into the chest and they actually survive versus one. It actually does depend on where it actually hits and what major vessels and organs it's missing. Oh my gosh, still breathing, still alive? If somebody were to have penetrating trauma and then lose pulses, you end up doing a thoracotomy where you basically crack open the chest and see if you can get to the heart and see if there's any damage to the heart itself, such as like a hole through the heart, and then you repair it immediately. A bullet to the brain, again, if it goes straight through, missing certain structures of the brain, you could potentially still be alive. It, again, depends on the area.
Oh my God, where am I? What happened?
Oof, coma breath.
Coma?
People do wake up randomly from being in a coma, so his airway was protected, didn't need a breathing tube or oxygen, but he was not waking up and then randomly woke up. This does occasionally happen.
Can I go home?
Well, you're not really ready, but if it's for revenge, you can stab me with this scalpel and then run out.
There are different types of scalpels out there. We use different types of blades on the top of these scalpels. And the most common instruments that we use in the emergency department is an 11 blade, a 15 blade, or a 10 blade. The 11 blade is the most common in the emergency department because it's pointy and straight.
Thanks.
What?
Oh, that was unnecessary, but cool.
Peter jumps out of the bed after being in a coma. The likelihood of being able to do that is pretty low because you're going to have atrophy of your muscles, your strength is going to be very low, and your ability to just jump and run is going to be significantly decreased, and he probably would fall and hurt himself on the floor.
So awesome.
What?
What?
That amount of trauma to your eye, call the ophthalmologist, try to prevent any touching of the eye because it increases all the fluid coming out. You'd actually want to put like a cup or a shield over your eye if there's actually eye trauma and get to the hospital ASAP.
Brad, if you're gonna play a fat guy on camera, you gotta learn how to do the rope swing.
Nice.
Okay, let me show you how it's done.
Oh! Holy cow, I was not ready for that at all. How does his arms just rip out? Could your arms be ripped out like that? Unlikely. You need a significant amount of force unless there is a defect already where the skin is already like cut wide open. To be able to pull all that connective tissue away is really hard to do.
900,000 views.
Wow.
So much.
That's great. Hey, can you click on a site for me? Otherwise, I gotta peck it with my nose like a tic-tac-toe chicken.
Peter is bandaged up. You actually see it all the way proximal to the shoulders. Unlikely that they would have done that. It's really hard sometimes to actually put bandages on certain areas of the body. You see people with funky bandages on their head. They'll actually slide right off, and that's why you actually have to wrap underneath the jaw. Oh! Oh my gosh. That's so dangerous. And we actually see this type of injury come to the emergency department often enough. Sometimes fans, sometimes propellers. In the face, if you get lacerated, a lot of times they bleed like stink, but they actually have pretty good repair as long as there's chunks of tissue not missing.
What happened?
Ah, I knew you'd catch it. I'm parting my hair on the other side now.
Oh my gosh.
Peter, thank God you're okay.
Hello, bosses, and not my family.
It's good. Peter wakes up and he's able to recognize these individuals, so that's a good sign of good brain function. Sometimes people who get hit in the head, they get something called transient global amnesia, where they can't remember events or they continue to repeat asking questions.
Where am I?
It does take time for that to go away.
You really gave us a scare there.
Oh, what do you mean?
What? You went into a coma after you were hit in the head by a fan. Oh, it was funny.
We induce comas all the time when somebody is super sick and we need to sedate them and put them on a ventilator. If you're just not waking up due to head trauma, typically you don't see that very often. You see somebody gets knocked out and then they slowly wake up.
Since the company was paying for your medical care anyway, we fulfilled your letter of medical intent for your sex reassignment surgery.
What?
They fulfilled what the letter of intent of what Peter wanted, but you need to consent for all those procedures and go through everything, so they wouldn't do that. Wow. So could that happen? Would that happen? No. People are like, well, I'm going under to have X procedure. Why don't you just do all the other procedures while I'm under? Somebody then is under anesthesia for a lot longer period of time. Your body is then required to also recover from so many different ailments that it actually might overburden the system.
Nice.
Mushrooms? Oh my gosh.
What you got there?
Okay, I'll tell you, but you can't tell anyone. You have to be really cool about this.
Yeah, of course.
These are mushrooms. It's a psychedelic drug. Makes you see weird things and feel happy for a few hours.
They're doing a lot of research to show that could this be helpful in different treatments of, say, like PTSD, anxiety, depression. They're working on it having to do with like safety and guidance and things like that.
Well, here we go.
Yeah, that's what my friends say too. Well, here we go. Oh, dude, I think I can feel it too. I'm getting a context high.
They use the word contact high and related to like marijuana smoke, right? So you smoke and then you're next to it and getting the contact of it.
But it's kind of nice for us all to be together like this, huh?
Oh, jeez. Psychedelic mushrooms affect multiple different areas of the brain. Frontal cortex, your hypothalamus. It affects like your perception, your senses.
I'm gonna cut my ear off to prevent World War II.
Oh God! Oh God!
Cut off his own ear. I was thinking like famous painter that cut off his own ear, Van Gogh. Yes, it can bleed. Is there a lot of blood? Typically proximal, yes. You have cartilage that does not have good blood supply, so it's really hard to repair. Oh my gosh. Could it make you pass out? Yes. Could this psychedelic mushrooms make you pass out? Yes.
Yes. I wonder.
If somebody were to have like ear trauma like that, just make sure that you hold compression to the area, get the bleeding to stop.
What the hell are you trying to do, man? Those mushrooms are messing you up.
He's doing a continuous stitch. So we call that a running stitch. We don't do that as often because if there's any issue relating to the wound itself and you have to cut the stitch out, the integrity of the rest of the suture is gone.
Lesbians and deaf women wear the same clothes.
Yeah, they sure do, buddy. All right, just stay calm, Brian. You'll get through this.
Sometimes you can have experiences where things go bad. Sometimes experiences go good. That's why they talk about having guided experiences with these psychedelic mushrooms to keep somebody on track versus these bad experiences.
I wish everyone was Robin Williams.
Oh, jeez. When you get electrocuted by lightning, that is direct current. You wouldn't see somebody doing that weird twitching thing. That is a contraction, relaxation, traction, what you would see with alternating current.
Boy, that looks enticing.
What?
Yeah, this is nice.
The biggest issues besides muscle breakdown, rhabdomyolysis, kidney failure, electrolyte abnormalities, cardiac arrhythmias leading to ventricular tachycardia or ventricular fibrillation leading to cardiac arrest and death. So these are things that you really worry about.
Oh my God, what happened?
You were in a coma, and then I kissed you and you woke up.
Stop it. Again, a coma again. Family Guy likes to use coma a lot.
He's in what we call a coma. Anyway, all your numbers are normal.
What numbers?
No idea. Well, congratulations. You're gonna be just fine.
Oh
my God, you're Robin Williams.
Peter's wearing bandages to his head and to his face, so yes, you can have open wounds due to electrical injuries, burns to the skin. They all need to be managed appropriately. So you can have 1st degree, 2nd degree, 3rd degree burns, 4th degree burns.
What's going on in here?
You gotta check this out. It's Robin Williams.
Oh my gosh.
Nurse is a nurse of course.
So, does somebody continue to be electrically charged after getting electrocuted? No. But you do know that we develop like static electricity, and that's just because of our own charges. A lot of things in our body are related to action potentials and electrical energy.
What's going on with your face?
I don't know what you're talking about.
Oh my gosh. So she got redness, blotchiness, even that left eye's twitching.
Look at my eye twitching.
Maybe it's a giant grin, huh? From having triumphed over my former bully.
There's a rash forming on the back of your legs.
Have any of you ever had a rash that just like formed this fast? Typically, the majority of the time we see this as like an allergic reaction, stress reaction, vasodilation where the blood vessels dilate and the skin changes color and gets flushed.
What? There is? Oh,
son of a...
Lois, what the hell's going on with you?
She like turned it into something.
I don't know. I think seeing Stephanie brought back one of my old junior high school panic attacks.
If you guys find yourself in a situation where you need to take, the edge off and experience some calm vibes, definitely check out Chillax by my company, Life Happens. It'll help you stay calm and balanced for the occasional life stresses. Oh my gosh, so now we see the spine from the opposite side, and you see it's like a S curve in the wrong direction. It's like scoliosis. Trauma can cause that. Obviously not in this circumstance, it wouldn't happen that fast. Oh my gosh, upper eyelid twitching, it's a muscle spasm. That could happen with stress. And you can have these different types of systemic effects of stress on the body relating to flushing, rashes, hives. People will get this when they get nervous. You see like blotchiness of somebody's skin. Oh!
Oh, God, buddy, I'm sorry. You okay?
The biggest things we always worry about in car crashes is whiplash injuries. Very rarely do you actually fracture your neck. You would expect after a bad car accident to have pain, probably 1 to 2 or even 3 days after. Anti-inflammatory medicines could be helpful in that situation. He's up a creek. This type of injury that Peter would sustain would be, again, a type of whiplash because of the force going into your body and your head kind of going the other direction. You're worried about skull fracture, you're worried about different types of intracranial bleeding. Most of the time, head trauma from a fall would be related to like a subdural hematoma, but it can also be a subarachnoid bleed from a trauma as well. You gotta be super careful with glass injuries. It becomes super sharp. So you have all these different places that you cut yourself. We see somebody and they're just cut up everywhere and we have to sew everything up. I've even seen patients where the glass is just embedded into their bodies. I have seen people come in, they've been pecked at by roosters for doing activities they shouldn't be doing. You definitely have to worry about puncture wounds by animals, different types of bacteria that they harbor. Did he just run over him? People come into the emergency department all the time with injuries related to being run over at low speeds, mostly. Sometimes people get crush injuries and their bones just snap under the pressure. I don't think windshields shatter in that way, otherwise there'd be a lot of debris everywhere. Usually windshields stay connected, that's why you see spider webbing on a windshield when somebody has a head injury. It's gonna squash them. Oh, nice, he moved out of the way. Nice, at least the kids get the ice cream. Man, they're just going at it. A lot of times people will come in with head injuries. A week or two later, they're still having headaches. Typically, there's something called post-concussive syndrome, where you can be nauseous and blurry vision. It can last anywhere from a couple days to weeks to months to even a year. Typically, you need to follow up with a neurologist. Oh, this is nothing like some electrocution. Potential things that we see in the emergency department: burns to the skin, burns to the underlying muscles and the tissue, and actually can cause cardiac arrest because our heart is basically beating based on electricity. A lot of explosive injuries. The biggest things we worry about besides like the burns and the tissue injuries is eardrum ruptures, and then you always worry about pneumothorax because it's a compressive injury. Ah, there we go. Astronauts, obviously, when they shoot off into space, they're getting a lot of G-force. You want to keep all the blood up in your head. G-force is like kind of pull the blood out. So there are different techniques that you can learn.
The hook method, which you go, hook! You look ridiculous, but it keeps the blood in your head.
Oh my gosh, the chicken's eyes are just flying out. I love it. But you get to see the big old punching bag in his throat. See the uvula and the posterior pharynx. Now there are no gravity. Oh, they're gonna be flying everywhere. Oh, look at the teeth going flying. So those are definitely some big molars. They definitely look like they're way in the back because of the roots. They don't come flying out like that. We'll have people come in where their teeth are missing. If you can bring the tooth in and it's been within like an hour and a half or so, we can just gently rinse it and put it back into place. If you get injured in space, where are the doctors? Typically, there's some sort of medical officer, and then you can always call back to get online medical direction. Yep, yeah, smart. Oh, good, yep. What? I don't know, does that happen? Does your head explode when you're out in space without a helmet on? If there are any astronauts out there, let me know. Does this sort of thing happen? The burn. Oh, nasty. We got people who vomit so much. Typically, there's no bad diseases that you potentially could get from somebody else. The biggest thing you always worry about is could there be blood in it. The vomitus itself, the acid, no, not an issue.
You can't really dust for vomit.
All right, it's gonna crash right into an oil rig. And now it's gonna be a big explosion at some point. We're finally seeing some blood coming out of Peter, but we don't know where it's coming from. It's got all the abrasions, ripped clothes, still has the black eye. His glasses are still intact though, which is quite impressive. Hot air, you got your 1st degree burns, which is your red, skin, painful, sunburn, and then you get your 2nd degree, 3rd degree, and 4th degree. Oh! Yeah, all those injuries with that massive wrench, it's going to cause fractures, and always worry about intracranial bleeding as well as dislocation of any joint that it's actually hitting. The shows make it look like, oh, no problem, it's benign to hit somebody with something like this. No, you're going to cause a lot of damage. Holy cow. The only hook injuries that we end up really dealing with are like fish hook injuries. It'd actually be really good if you actually bring in another version of the hook so we can actually see what the end looks like. Wow, actually quite creative. Face, you gotta be really careful because it's airway compromised as well. If there's burns to the face, you can have swelling of the mucosa within the posterior pharynx, and then that could close up your airway. I don't know, his hand's still on fire. He's gonna be one cooked chicken ready to eat if he lets it keep going. Uh-oh. The hand of fire. So you can actually see on Peter, his face gets depressed on that right side where he's getting punched. That actually does happen. And obviously blood coming out the nose. Very common. It can actually go backwards into the lacrimal ducts and actually come out your eye and have bloody tears. Sometimes that freaks people out, but it's nothing dangerous. Oh! Okay, holy cow. The heat of the engine relating to a spaceship, I think is pretty hot, so I don't think you got a chance. Well, the oil rig finally blew up. Peter, he survived, of course. I don't know how somebody walks away from that. It's got a lot of open wounds. Salt water probably pretty good for it, even though there's a lot of microorganisms in the water. The likelihood that it'll have an infection is probably pretty low. This is something you definitely need to take a look at.
I'm saying the Simpsons suck. Why, you?
Uh-oh. Trash talking. Oh, nice. When somebody gets banged in the nose, typically it bleeds pretty easily. Usually it's not a significant bleed. Not very often do people have fractures in their nose that need to be replaced in the sense of put back in line, but sometimes that does happen. Uh-oh. Oh, right into its face. Same idea. When you're getting that much trauma, you're getting dazed, you're getting dizzy. Things are probably a little bit distorted as your brain is kind of sloshing around. Ah! The accidental moon. How many people have mooned their friends? Let me know in the comments. Obviously, the strangulation injuries that we worry about. You always think about injury to the major vessels in the neck. You can actually cause tears. Even if they don't go through the whole vessel wall, they actually increase the risk of developing a clot, and then it can increase your risk of having a stroke. So we obviously need to check that out.
What the hell? That really hurts.
No, it doesn't. I do it to my son all the time.
You strangle your son? That's insane. No wonder he's fat and stupid and masturbates all the time.
That's your son!
Oh my gosh! The headbutt in that area when somebody gets a fracture up here, we call this Lafort fracture, and there's different levels of it having to do with the injury and how much fracture of the bone there is, and depending on where it is. Oh, I don't think the glass would break that easily. That's why it's really good to have these safety devices in cars that can pop a window really easy in case you're ever in a life-threatening event where you need to get out of the car. What? Yep, not survivable in the real world. Getting smashed up against the buildings, the amount of trauma, potential fractures, contusions, skin that's just being ripped off is huge. Then just getting torqued around the tree, that's gonna leave you paralyzed most likely. Oh no! Oh my gosh. We'll get reports where the car is one place and the individual is way over. It's good for us to know how much velocity was in the car accident. We always think the worst because of the amount of blunt force that can occur. Oh my gosh, that is a massive rollover. Obviously right into the power plant, the nuclear power plant.
Nuclear.
We don't really deal with a lot of nuclear things.
It's nuclear, dummy. The S is silent.
At the hospital, but we are prepared for it. There's always drills that are run. Basically, you just have to decontaminate people before they come into the buildings, and typically tents are set up outside of the emergency departments. So far, we have so much head injuries and nobody's passed out yet. It's actually quite interesting. If I was a writer of this, I would at least have a few seconds where somebody's like unconscious and then pops right back up. Oh, wait a minute. I know what these are because my wife has one of these. These are Emmy Awards.
Hey, that's no fair. I don't got none of them.
Oh, that is hilarious. I didn't know Family Guy hasn't gotten any. They should get some. There's spikes sticking into the wall. If it hits Peter, it's going to cause some puncture wounds and injuries. We actually don't close them up. We're going to lock bacteria in there, so you actually just let them be. And we're getting some gas leaks, radiation leaks. Obviously, it's a vat with some steam coming off it, so maybe it's really hot. Probably going to cause a lot of burn. It's going to singe all the skin off. Then it's going to go into the subcutaneous tissue, your fat, and then the concern is it's going to get to the muscle. Oh, jeez, it's bubbling. Ah! There's a skeleton. Even sometimes hot temperature will actually even melt all the bone as well. What? Wait a minute. Homer just regenerated himself. Nice, he's ripped. Oh, and Peter the same way. Look at those forearms. Oh yeah. Wow, what actually a good depiction, almost like in the nuclear fallout type scenes with the mushroom cloud, compression of the air, things just disappearing. Crazy.
Perfect. The Earthlings are destroying themselves. Yeah, it's really great, isn't it, guys?
Oh my gosh, what a good combination. That's Roger from American Dad. I'm becoming an expert, not just in medicine, but in these cartoons because I've seen them so much now. Back at it. Oh. Fall from that height, you know what I'm gonna say. The likelihood of survivability is very low. Any fall greater than probably about 15 feet is a significant trauma and potential for injury. Oh, there goes some teeth. Oh man, ouch. I do like that every single tooth is depicted as a molar. You have incisors, you have the canines, and you have the molars. If your tooth comes out, make sure you go find it. Probably the easiest thing to do is actually just put it back in your mouth. The saliva that's in your mouth is fine. Oh, there goes Homer. Oh man, what? I wasn't ready for that. We only have one attachment to the eyeball itself, but typically we're gonna have the optic nerve and then we're gonna have 6 muscles around the eye and the back attaching to it. It takes a lot of force to have it actually move out of its socket. Nice. Oh geez. Oh man, the hand is super sensitive. Obviously we have lots of nerves all over our body, but the hand, there's so many intricate movements to it, a lot of nerves to it, and that just hurts like heck. Don't do it. Don't do it. Homer, good core muscular work to be able to sit up that fast and use your noggin to knock him right in the you-know-where. Oh, Peter is knocked out cold, where he's actually drooling. So good job. I take back what I said earlier. Oh my gosh, he's waking up. Good depiction of double vision, blurry vision. We ask patients all the time when their visual field is changed, is it double vision? Are you seeing two objects?
I'm seeing double here.
Or is it blurry vision where it's one object and it's just very, very blurry? How is that even possible?
What are you still doing here?
I think you're gonna get a kick out of this. You're parked behind me at your place.
That is funny.